We're back and answering your questions about the coronavirus with Cone Health Medical Group Family Medicine Physician Dr. Zoe Stallings. Remember, you can text your questions, the number right there at the bottom of the screen, 336-379-5775. All right, this person is asking, will a ceiling fan in a room help if people are sitting inside the living room and they put the ceiling fan on?
Actually, that helps. We do want to circulate fresh air, especially if you have an open window to kind of bring in some fresh air. So that is actually a good option to do, is to put a ceiling fan and have a fresh window open with some fresh air to air out the space that you're in.
All right, this person says, my sister was sick. She lost her taste and smell and had all the COVID-19 symptoms. But when she took the test the day she got the symptoms, her test came back negative. It is evident she had COVID and is still not better. So how does this happen?
So the tests in general are not 100%. So that means when we take the test, and this is why we tell people once you've taken the test, you still quarantine, because you can have something called a false negative. It means that a test, if it were 100%, would be positive, but we can miss it sometimes. And so our recommendation is still quarantine and look at your symptoms as a measure of how sick you are.
All right, this person says, if a person had COVID in July, could they still pick up the virus and make others sick even though they have antibodies?
Yes. There's a lot of research going on right now about how long the antibodies last and their activity level. That's the background for vaccine research. And so we still say that we are seeing healthcare workers who have had reinfection. The reinfection rates are variable, but you can be reinfected. It's just a measure of that you were exposed, but we don't know if you are immune. So the presence of antibodies does not necessarily tell us your immunity. And if you're not immune, you can get sick again. So the best thing is not to rely on the presence of antibodies, but to actually wear a mask and protect yourself, because you can get it again.
Okay, this person says, can you remind me how many people is it safe to be around during the holidays?
So the recommendation is the smaller, the better. But the state has a guideline that says 10 people, so no gatherings of more than 10. And so I usually say it doesn't make us any more secure if you're on around 9 people, if 6 of those people don't live with you. So it's more important that you try to stay with the household members that you normally are around, because no matter the size, those people put you at risk if they don't already live with you. So my advice is still not to look at the number of people, but to think about, are these people I'm normally around and live with? And if I don't live with them, I'm going to try to limit my exposure to them.
If the virus is mutating, this person says, how can the vaccine be effective for all strains of COVID-19?
So that's a very good question. Someone's been reading, and that's good. That's a good thought. The thought is that we're trying to start with a vaccine in general, just like the flu vaccine, which we encourage you to get your flu vaccine. We try our very best to try to target and aim at the parts of the vaccine that make us the sickest. However, nothing is 100%. And so we still want you, even if you get the vaccine, to still wear your mask. It does not mean that you're invincible. And so our recommendation is still going to be, at this point, there's not a globally available vaccine. The vaccines are in the early stages. It's not something that we want to rely on at this point. But just like with every other virus, even if you have the vaccine, you can still get sick. The thought is we want to get you less sick. And so our goal is to try our best to start with a strong vaccine that can help us. And that's still being researched.
If a coworker goes out of state to visit family for Thanksgiving, how worried should I be when they come back to work on Monday, and how can I protect myself?
Very good question. So in terms of protecting yourself, you can't control what your coworker does, but you can control what you do. Put your mask on by covering your nose and your mouth, loop it behind your ears, and keep that on at work. This way, you know that whatever is around you, you're still protected. It doesn't need to be, I try to encourage and talk to my patients about the fact that if you're around someone who does not wear their mask, even if they're ill, I am a physician who sees patients who are sick all the time. And sometimes they might talk to me, their mask might not fit well, and I still keep my mask on and I get protected. So you would protect yourself in the exact same way, wearing your mask so that when your coworker comes back, you are protected, and encourage your coworker to do the same.
This person says, my wife has AFib and is on meds for it. Will she be able to get the COVID vaccine safely when it becomes available?
So when it becomes available for the general public, we'll just go ahead and go over guidelines. And in fact, just like the rest of the vaccines, we still talk about things that are what we call contraindications, people who should not get it. Atrial fibrillation would not be one of those. But I will tell you, the flu vaccine is available and we are giving those out now. So your wife should definitely get a flu shot.
This person says, I became very ill with COVID. However, I was able to recover at home. My isolation was over October 29th, but I still have an intermittent cough and experience very low energy. How long approximately could this last?
So everyone's a little bit different. You know, in terms of recovery, we call it functional reserve. How quickly are you able to bounce back? If you were very sick before you got sicker with this virus, then it will take you even longer. So it depends on the state that you're currently in. But there's no answer in terms of how long. What we do want you to do is work on resting your body so that you decrease the stress on your system, eating well so that you're not eating too much of the junk foods and fast foods so that you give your body good nutrients, and making sure that you don't get reinfected with either this virus or some other virus like the flu. Staying home and staying safe to prevent it from making you sicker or making others sick. But the moment that you finish your isolation doesn't mean that you're going to be cured. It just means that you've had enough time to begin the recovery process. So we do want you to take care of yourself. Some people can be sick for up to 6 weeks to 3 months.
6 weeks to 3 months. Okay. This person is asking, why is there so much emphasis on people who you live with? My family goes to work and school. What makes them more safe than someone who doesn't live in my house?
So the emphasis is truly, well, that's an interesting way to phrase that. So we are saying wear your mask all the time when you're out of your house. The people you live with, you share spaces, you share utensils. And so the emphasis is keeping that space small, meaning you can take your mask off and live your normal life in your home because the people live with you, you share some of the same things. It's not the same as going to work in the break room and taking your mask off, even though you see them all the time. Because those people go home to a different set of people. So we think of it as when we do contact tracing, for instance, if a person has a virus, we then look to see the coworker and their family members have now been involved. So that's how this virus has been able to spread so quickly, is that you go to work and you feel like, well, I'm here 12 hours around these people all the time. Could I take my mask off? Sure. But you're going to spread it to their families.
All right, we thank you so much for your time. We're still getting more and more questions, so we're going to try and be able to answer them and then put them online a little bit later on. Thank you for joining us today and for your questions.